How does cystic fibrosis affect your entire body? Imagine a condition that touches nearly every part of your body, not just your lungs. That's what cystic fibrosis does. It is a genetic disorder that causes the body to produce thick, sticky mucus that can clog and damage many organs. This mucus buildup is the core issue behind many of the health problems associated with cystic fibrosis. Starting with the respiratory system, cystic fibrosis most famously affects the lungs. The thick mucus blocks the airways, trapping bacteria and leading to frequent infections. This causes inflammation and damage to lung tissue over time. People often experience persistent coughing, wheezing, and difficulty breathing. Because the tiny hair-like structures called cilia cannot move the mucus effectively, clearing the lungs becomes harder. As a result, lung function gradually declines, and some individuals may develop respiratory failure if not properly managed. Moving to the digestive system, the thick mucus can block the ducts of the pancreas. This prevents digestive enzymes from reaching the intestines, which are essential for breaking down fats, proteins, and vitamins. Without these enzymes, nutrients are poorly absorbed, causing malnutrition, weight loss, and poor growth, especially in children. Many people with cystic fibrosis develop pancreatic insufficiency, needing enzyme supplements to help digest food. The liver can also be affected if bile ducts become blocked, leading to liver disease such as fatty liver or cirrhosis. Additionally, thick mucus can cause blockages in the intestines, known as distal intestinal obstruction syndrome, which can cause abdominal pain and vomiting. The endocrine system is also impacted, particularly through the development of cystic fibrosis-related diabetes. This occurs because the damage to the pancreas affects insulin production. About 1 in 5 teenagers and half of adults with cystic fibrosis may develop this form of diabetes, which requires careful management. In the reproductive system, cystic fibrosis often causes infertility. In males, thick mucus blocks the vas deferens, the tube that carries sperm, leading to infertility in most cases. Females may experience reduced fertility because of thick cervical mucus, but many can conceive with medical help. The musculoskeletal system can also be affected. Malnutrition and chronic illness weaken muscles, especially in the arms, legs, and diaphragm. People with cystic fibrosis are at higher risk for osteoporosis, a condition where bones become fragile and more prone to fractures. This is due to poor absorption of vitamin D, chronic inflammation, steroid use, and delayed puberty. Regular screening and vitamin D supplements are important to maintain healthy bones. Beyond these major systems, cystic fibrosis influences other parts of the body too. Sweat glands produce salty sweat, which can lead to electrolyte imbalances and dehydration. Chronic sinus infections and nasal polyps are common because of mucus buildup in the sinuses. Overall energy levels and quality of life can be affected by ongoing infections, inflammation, and nutritional challenges. In summary, cystic fibrosis is a complex multisystem disease. It primarily causes thick mucus that blocks and damages organs like the lungs, pancreas, liver, reproductive organs, muscles, and bones. Managing this condition requires a team of healthcare professionals to address infections, nutritional needs, blood sugar control, bone health, and reproductive concerns. If you or someone you know has cystic fibrosis, it's essential to work closely with medical providers to develop a personalized care plan. Always seek advice from healthcare professionals for diagnosis and treatment options tailored to individual needs.